Good evening and welcome to the final class in lower limb. In today's class, we shall see the problem-based questions related to lower limb. In this session, we will see 7 case scenarios related to the important topics you have already studied in lower limb. The answers to these clinical problems we shall try to discuss in our live class coming up on Monday. PBL number 1 tells the history of a 47-year-old police woman who complained of a dull aching pain in the lower part of both legs. And this pain was particularly severe at the end of a long day of standing at her work. Naturally, at her work involved standing for a very long period of time. And on examination, the patient was found to have dilated and tortuous veins on the medial side of both legs. So here, a police woman complaining of a dull aching pain in the lower part of both legs, which was particularly getting severe at the end of a long day after standing for a very long period of time. And on examination, the patient had dilated and tortuous veins, especially on the medial side of both her legs. We will see the questions for PBL 1. Of course, you have to work out the answers for these questions, and we shall discuss the same in our next class. You have to name the clinical condition, and you have to mention the exact veins which are involved in this particular case. You have to give the most probable reason for the dilated and tortuous veins. The next is to describe the formation, the cause and termination of great saphenous vein. And you have to name the veins that connect the great saphenous vein to the deep veins. And you also have to mention the direction of blood flow in these connecting veins. Coming to PBL 2, here an 18-year-old female medical student was late for her class and was running across some rough ground when she stumbled and over-inverted her left foot. Please note, over-inverted her left foot. She was immediately taken to the casualty, and on examination, it was revealed that the lateral side of her left ankle was too painful to touch, and it was somewhat swollen. A small area of great tenderness was found below and in front of the lateral malleolus. She was advised an X-ray examination of the ankle joint, but this X-ray was negative. That means it didn't show presence of any fracture related to the ankle joint or the bones around the ankle joint. Coming to the questions of PBL 2, you have to give your most probable impression and which ligamentous structure on the lateral aspect of the ankle joint is most likely to be involved in this case. So we have already ruled out a possibility of a bony injury, that means a fracture or a dislocation of an ankle joint. So you have to think about a ligamentous injury, and in this case, which ligamentous structure on the lateral aspect of the ankle is most likely to be affected in this case. And once you have identified this structure, you have to name its parts. Question number 4, you have to describe the other ligaments of the ankle joint. Question number 5, you have to name the bones taking part in the ankle joint. You also try to study the type uh, and the articular surfaces of the angle joint. And finally, you have to describe the movements of inversion and eversion, specifying the joints involved and also the muscles producing these movements. Coming to PBL 3, this clinical scenario we had already discussed during our discussion on the knee joint. Here, a medical student, while playing football, received a blow to the lateral side of the knee. He complained of a sharp pain on the medial aspect of knee joint and was unable to extend the leg. And on examination by the physio, the knee was found to be swollen and severe local tenderness was found along the medial side of knee joint. So here the person received a blow to the lateral side of the knee and he had a severe pain on the medial aspect of the knee joint along with swelling and severe local tenderness on the medial aspect of the knee joint. Coming to questions of PBL 3, here also you have to identify the particular ligamentous structure related to knee joint which is likely to be most probably affected in the above scenario. And once you have identified this particular ligament, you have to describe its attachments and relations. Then you have to name the intra-articular ligaments of the knee joint. Number 4, you have to name the movements which are taking place at the knee joint and name the muscles producing these movements. You have to name the muscle that has origin inside the capsule of the knee joint along with its action and nerve supply. And finally, you have to mention what is the unhappy triad of knee. In the case scenario of PBL 4, a patient with very low hemoglobin was given an intramuscular injection of iron in the right gluteal region. And after a few weeks, he complained of difficulty while stepping on the right foot. And this particular patient also complained of a numbness and tingling sensation on the anterior and lateral side of right leg and also on the dorsum of the right foot. And on neurological examination, the patient had difficulty in dorsiflexion and eversion of the right foot. And further, a sensory examination revealed a sensory loss on the dorsum of the right foot and all toes except the lateral side of little toe. Coming to the questions of PBL 4, first you have to identify the anatomical structure in the gluteal region which is most likely to be injured by the injection needle. And once you have identified this particular structure, you have to give its origin and termination. You also have to name its two components. Then, based on the symptoms and signs this particular patient is having, you have to name which component of that particular anatomical structure is more likely to be affected here. You have to give the anatomical reason for the difficulty in dorsiflexion and eversion of the right foot. And you also have to mention the anatomical basis for the sensory loss on the dorsum of foot. PBL 5 is a simple and straight forward question. So here a candidate applying for recruitment in the army was rejected because he was found to have a pes planus or flat foot in the medical checkup. In the first question of PBL 5, you have to clearly define what is meant by pes planus or flat foot. Secondly, you have to explain the anatomical factors that are responsible for the flat foot or pes planus. Number 3, you have to draw a diagram to show the bones forming the medial longitudinal arch of foot, and you also have to mention the key factors responsible for the maintenance of this arch, that is a medial longitudinal arch. And finally, you have to explain briefly about the spring ligament. PBL 6 depicts a very common injury found in elderly persons. So here a 75-year-old woman was not able to move her right lower limb after a minor fall. And on examination, the right lower limb was found to be shorter and toes of her right foot were pointing laterally. Coming to questions of PBL 6, first you have to give your most probable impression in the above patient. Then you have to give the anatomical reason for the shortening of right lower limb in this patient. The rest of the questions are related to hip joint. You have to name and describe the articular surfaces of the hip joint. You have to name the 3 major ligaments of hip joint. You have to enumerate the movements taking place in the hip joint along with the muscles producing these movements. You have to draw a diagram to show the arterial supply to the head of the femur. And finally, you have to mention the serious complication of this type of injury. Coming to the last PBL, here a 65-year-old woman was admitted with complaints of abdominal pain and repeated vomiting. And on examination, the abdomen was distended and excessive loud bowel sounds were heard. On examination, a small lemon-sized swelling was found on the upper medial aspect of right thigh. This swelling was located infralateral to the pubic tubercle. The patient told that she was having this particular swelling for the last 5 or 6 months. A diagnosis of acute intestinal obstruction secondary to hernia was made by the surgeon. Coming to questions of PBL 7, you have to name the hernia which is located below and lateral to the pubic tubercle. You also have to name the passage through which this particular hernia has entered into the thigh. You have to give the anatomical basis for the strangulation of this particular type of hernia. You have to name the boundaries of femoral ring. You also have to mention the direction of this particular hernia and why is it important to the surgeon, especially during reduction of these type of hernias. And finally, you have to describe the femoral sheath in detail with the help of a diagram. So these are the core areas in lower limb which can be asked as a PBL long essay question. Hip joint, knee joint, ankle joint, the arches of foot, sciatic nerve, the venous drainage of lower limb, and femoral triangle, including the femoral sheath. So in this class, we have discussed the different case scenario based problems of the lower limb, and in the next class, we'll try to see their solutions. Thank you.